Hi everyone, my name is Stephanie Gonzalez, and I wanted to talk to you about another alternative that you could use to managing your blood sugar, particularly if you are someone who has type 2 diabetes. When it comes to diabetes and obesity, it seems very common, as if everyone you know has either had it or knows someone who does. You can get diabetes either through your genetics or your lifestyle habits, such as eating and how active you are. One fact is almost 25% of people aged 60 and older are diagnosed with either type 1 or 2 diabetes, and according for the Centers for Disease Control and Prevention say that obesity has affected 93.3 million of US adults in the years of 2015 through 2016. This medication is called Victoza. It is a liraglutide injection that can come in doses of 1.2 milligrams or 1.8 milligrams. What I like about the Victoza injection, it is fairly similar to like an insulin pen, which is familiar for you to use if you are familiar with type 2 diabetes. If we are getting creative here, let's say this is the Victoza pen here. So what you would have to do is take off the lid, and then you have to put your needle, and then the needle could vary to how you're comfortable with or what your insurance can afford. And then so you really have to just dial it up to like a regular insulin pen, and then you squirt it out to ensure there is liquid coming out. And then what you do is you then dial it to 1.2 or 1.8 according to your doctor's orders, of course. And then after that, you put it into a fatty tissue, particularly in your lower abdomen area. Or if you have someone else doing it for you, you can do it in your arm, particularly like this is your biceps. So you would do it right back here in the tricep area, especially where there's all the fat. Like I have mentioned before, the Victoza injection is fairly easy to use. It is taken once daily, and it is the same dosage every single day. And it does not need to change according to your blood sugar level, or it does not even depend on how active you have been during that day. I know some people who've had diabetes before go on a sliding scale, which could be a little more difficult, but this makes it simple as it's the same dose every day. And if you are debating on whether Victoza is the right medication for you, some information is, again, it is not insulin. It is just like another alternative to help regulate your blood sugar, and it is proven to lower your A1C as well as the blood sugar. And it also, another benefit, it reduces the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes and who are currently treating their cardiovascular disease. So what the actual Victoza medication does when it enters your body is it actually goes into the pancreas area, and then it helps produce more insulin by going to those important cells in that area called beta cells, and it helps them, kind of works alongside to help produce insulin the way your body is supposed to. The reason I decided to choose Victoza as my health marketing product is because I've noticed type diabetes, type 1 and type 2 have been increasingly becoming a major issue, and especially in kids and adults, especially in the United States, just with really bad habits, having fast food, and then with all the technology, kids and people in general are just stuck more inside with technology and social media than actually going outside. So I did want to bring more awareness to other alternatives. Obviously, when you are treating to type 1, type 2 diabetes, the best way, along with medications, is to exercise and have a good diet. But I just know it is a harder struggle in this day and age, just with all the technology and how times have changed. The Victoza pen is very affordable. If you want, you can join their savings card program, which means you could pay as little as $25 for each pen. Victoza is covered by most major health plans, including Medicare or Medicaid. And if you don't have either, you can join their diabetes patient assistance program, which provides free medicine to those who qualify. The personal level of me choosing this is because I have family members who unfortunately have passed away with type 1 diabetes. And it was not because, you know, they were having bad diet. It was just like the resources. I am Hispanic, so I have family members living in Mexico, and then to get these resources like Victoza and insulin was just a lot harder, as the poverty rates are a lot higher than they are in the United States. So it touched me personally as well as professionally as I work with people with diabetes, to talk about another alternative that is fairly new, that seems a lot easier, and to just give people more options as to how they want to regulate their blood sugar with those who have type 2 diabetes.
A possible side effect of the Victoza is inflammation of your pancreas, which is pancreatitis. Stop using Victoza and call your healthcare provider right away if you feel severe pain in your abdomen area. They will not go away, either if you are or without vomiting. Another side effect could be hypoglycemia. Signs and symptoms of that is dizziness, blurred vision, anxiety, sweating, slurred speech, hunger, confusion, shakiness, weakness, headache, fast heartbeat, and feeling jittery. If you or someone you know has kidney problems or kidney failure, they may have dehydration, and symptoms of that is diarrhea, nausea, or vomiting, which can cause kidney problems to worsen. You can start having gallbladder problems if you take Victoza. Some symptoms of that could be stomach, area pain, fever, nausea, or vomiting, or the skin or the white part of your eyes turns yellow.